Now, we have Dr. S.p.prasath, who's a senior member in Indian Dental Association, also co-owner of Malar Dental Hospital, and charter member in Lions Club. He holds several awards for his service and excellency in dentistry. I kindly invite him to address the gathering. Over to you, Dr. Prasath.
Good morning to one and all. My pranams to Dr. P.S. Lalita, founder Reiki Center of India, Dr. Sunanda Ravi, psychologist, who spoke earlier, and the whole team behind this World Reiki Day celebration. Your smile, your energy. Yes, it is true. Smiling is an unique human expression and serving as a universal language. A healthy dentition, along with the facial muscles, supports a good smile. In Tamil, there are few old sayings which explains the importance of healthy dentitions, like "Pal ponal sul pohum." That is, it supports it in speaking. Another is "Norunga tindral nuru valvu." That is, it helps in chewing, grinding the food properly, which in turns good body and longer life. Each tooth is important, be it milk teeth or permanent teeth. So it has to be taken care properly. The most common diseases of dentitions are tooth decay and gum diseases. Reasons are multifactorial, including genetic and immune response. Tooth decay. Usually, it starts when we take high sugary and sticky foods, and this sugar is converted into acid by oral bacteria and causes breakdown of an enamel and leads to decay. Another is gum diseases. Due to improper oral hygiene, a white sticky substance called dental plaque forms over the tooth surface, and this leads to gum inflammation, eventually bone destruction, mobility, and tooth loss. You can see that the treatment part of the dental caries and its restoration. Okay. Usually, by regular dental checkups and self-examination, we can identify the cavities at an early stage, detecting the black spots or white chalky spots with or without cavitations. In this stage, the decayed portion of the tooth is removed and filled with materials like cements and composites, which are tooth colored. So, in the third picture, you can see some filling materials like composites, silver amalgam, and even gold. So, with the help of the second picture, you can see some drill. So, through which we remove the dental caries or decay and we will fill it with. When does the tooth need root canal treatment? If the decay progresses deeper to the innermost layer of the tooth called pulp, causing infection, at this stage, the patient may feel pain, sensitivity to hot and cold stimuli. In this stage, root canal treatment is essential to save the teeth instead of getting it removed. In this picture, you can see the process of root canal treatment. It is a process of removing the infected pulp under local anesthesia, followed by cleaning, shaping the root canal, and sealing it. It is also advised to the tooth which are fractured due to traumatic dental injuries during fall or accidents. So in the picture, the second picture shows the drilling. We usually drill deeper for the root canals and reach the canal orifice. And the third picture, you can see the cleaning shaping through file. We use file called the hand instrument through which it can be cleaned. So finally, the last picture, you can see the filling materials. We usually use gutta over which we use composite or other filling material to close it. So this is the process of root canal treatment. Can you see how the gums are swollen and full of deposits over the tooth surface? So this is a gum disease, classical picture. So usually we have two gum diseases, depends upon its severity. That is gingivitis and periodontitis. So gingivitis are earlier and reversible stage of gum disease. It can cause redness, swelling, and bleeding of gums. In this stage, we can do scaling followed by routine home care dental hygiene practices like brushing regularly twice a day and flossing. Next is periodontitis. Periodontitis is advanced, irreversible stage where the infection damages the underlying bone and tissues. This results in mobility and spacing in between the teeth. The treatment involves scaling, root planing, and flap surgeries. Depends upon the severity of bone loss, which is confirmed by radiographs. Now let us see how a single tooth loss can affect the occlusal harmony. Even single tooth loss initiate a series of chain reaction. As you can see in the pictures, the tooth loss disrupts the entire dentition, causing adjacent tooth to shift, the opposing tooth to extrude, and leading to malocclusion. Of missing tooth is very important. Now, what are the types of artificial replacement? When it comes to tooth replacement of missing natural teeth, options ranges from the fixed partial dentures, removable partial dentures, dental implants, and complete dentures. The most common types are fixed partial dentures, where you can replace single to multiple teeth, where we take supports from neighboring teeth or adjacent teeth and missing tooth is replaced in between as crown and bridge. It is permanently cemented on the tooth, which comes in various tooth colored materials like ceramic, zirconia, and procera, etc. So in the picture, the second picture indicates the bridge, the crown and bridge, where the adjacent tooth is shaped and we take support from that supporting teeth. So where the crown of the bridge is cemented permanently and the replacing teeth is made placed in between that supporting teeth. It's called crown and bridge. Next one is a removable partial denture. In this type, we take support from underlying tissues. Comes with the acrylic plates where the missing tooths are placed, and this can't be weird round the clock. The next one is dental implants. In the first picture, you can see the dental implants. These are recent trends where biocompatible titanium screws are placed in the bone over which crowns are placed. In the third picture, you can see some dentures. It is a complete denture. That is a full mouth denture where the patients have lost entire dentitions. So for loss of all teeth, so complete denture, implant supported oval dentures, and full mouth rehabilitations are the options. So these are some tooth replacement options. Dental problems and its systemic connections. Can you believe that? Yes. Recent study shows maintaining poor oral hygiene and deposit over the teeth can eventually cause cardiac diseases. In these patients, bacteria in the deposits release its toxins, which enters the systemic blood circulations and reaches the blood vessels of heart, and thereby causing inflammation and tiny clots in the blood vessels, leading to cardiovascular diseases. Similarly, in diabetic patients, due to high glucose level in saliva, tends to increase the plaque buildup, thereby causing gum disease, and vice versa. Inflammation and gum diseases in oral cavity leads to poor sugar control. So in this picture, you can see indicating the second pictures, you can see even calculus or what you call as a deposit present in the dent attached to the tooth. It has a millions of bacteria and pathogenic bacteria. So when we enter the blood circulation, it reaches the heart blood through blood vessels, and it causes bacteremia and causes plaques or clots in the heart. It may lead to cardiovascular diseases. Likewise, in diabetic also. Trigeminal neuralgia is a severe chronic pain conditions affecting the trigeminal nerve. This is one of the cranial nerve, causing sudden intense electric shock like or stabbing pain on one side of the face, often triggered by touch, even chewing or talking, usually caused by blood vessels compressing the nerve, which is next to or adjacent to it. So in this picture, the second one, so it is indicating where the location, exact location where you get the neuralgia pain. So you get the pain wherever the nerves supply of the trigeminal nerve is. So treatment includes anticonvulsive medicines like carbamazepine and even surgeries in some rare cases. In that surgery, they will do a decompression of blood vessels very rarely. The oral care for young children. The oral hygiene measures should start when the first tooth erupts in the oral cavity, that is, 6 months after the birth of a newborn. When teeth comes in, start brushing with the finger brush twice a day and visit the dentist by your baby's first birthday, which help to spot the problem early. So in this picture, the first picture indicates the nursing bottle caries or rampant caries is the most common and severe tooth decay in infants and toddlers. It is caused by prolonged exposure of tooth to the sugary liquids from bottle feeding and even breastfeeding during sleep. This causes bacteria to create acids that destroys the enamel, and usually it starts on the upper front particularly. How to prevent it? It involves avoiding bedtime and avoid sugary pacifiers. The application of fluid like fluoride varnish in the teeth by the dentist, it will reduce the occurrence. And usually, if it is an initial stage, it can be filled with the cements. Or if it is gone deep, we can do even root canals, that is pulpectomy and crowns, stainless steel crowns in those cases. Next, the picture shows thumb sucking habit. The thumb sucking habit is a common normal reflex in babies and toddlers up to 2 to 4 years. But if it continues after that, it causes protruding upper front teeth, causing malocclusion and open bite. So, timely intervention of this habit is must. Dentist will correct it by delivering habit breaking appliance. The appliance is called habit breaking appliance at the earliest, or orthodontic treatment or braces in the later stage. So the second picture shows the habit, and it can be like intercepted by giving a habit breaking appliance where the wire like thing will have a spikes, and we permanently cement in the on the teeth, the upper molar region, so that whenever the child is putting their fingers inside, so it will poke or something, it will hurt them, so that they will avoid the habit and it will be stopped as early. Also avoid permanent but so the earlier stage. So we have to go for a orthodontic, that is braces. The third pictures indicating the braces how it is. Later stage. I come to geriatric patients, older individuals. The most common problem in older adults related to dentitions will be attrition and complete loss of all teeth. So attrition is due to normal wear and tear. The enamel part of or entire part of the dentition will be eroded or treated. So the patient may feel sensitivity, uh, mild to moderate in the early stage, and it may be severe when the whole enamel and dentin is eroded. So it becomes severe. So it causes sensitivity in teeth, difficulty in chewing, and also pain. So treatment part in earlier stage with the help of a desensitizing toothpaste. In the milder cases, usually there is a lot of desensitizing toothpaste in market. You come across like Sensodyne, whatever, but that you have to apply. They will take it in the finger and just have to apply, not as a toothpaste. Take a little bit pea-like shape um, paste, desensitizing toothpaste, and I applied over the tooth. And we have to wait for another 10 or 5 to 10 minutes, and you can wash it. This will help in the early stage. So if it is severe, you have to seek dental opinion. Okay, it may require root canal even, and in some cases you have to extract the teeth. So another common problem is a complete loss of teeth. So in this case, when conventionally we advise depends upon the dentures. So complete over dentures, that is with the help of implants. So it will be have a more retentive things. So and even sometimes full mouth rehabilitations where we can attach some like bridges also. So these are the options. The tobacco usage, the picture shows how much nicotine stains are there over the teeth. It has a deleterious effect on teeth and general health. So tobacco usage in form of smoking or chewing may associate with oral cancer. Quitting the habit will reduce the risk of getting it. Don't ignore the warning signs like long-standing oral ulcers that is non-specific without healing, and long-standing white or red patches in the corner of the mouth or the cheeks in the mouth. Even chronic irritations like ill-fitting dentures, sharp tooth may trigger non-healing ulcer. So that is also it will end up in getting cancers. So always have to self-examine for the people who have the ill habits. Final take-home message: brush your teeth twice daily. Avoid using pins and toothpick as a dental aid. Self-examination to identify early tooth decay and bleeding gums. Periodic visit to a dentist. And you have to take healthy and balanced diet. Thank you. I thank every one of you for listening patiently to my speech. My sincere thanks to Ms. Devi, President, Reiki Center of India, on giving this opportunity to participate in the celebration, and appreciating for her teamwork on planning and executing this event. Last but not the least, I thank my better half, Dr. Satya, MDS, periodontics, who have helped in preparing this presentation, and wish every one of you a happy World Reiki Day 2026. Thank you.
Thank you so much, sir, for your enlightening speech on different types of tooth care. I'm able to recollect the different treatments I have actually. So these days, actually, it's becoming very important to take care of teeth because of the kind of food habits we have. So it was very enlightening. Thank you so much.
Thank you.
Thank you for coming. Now we like to honor him with a trophy virtually as a mark of respect and gratitude for being a support and honoring us with his presence in this occasion. Thank you so much, sir. Thank you. So anyone has any questions, you can raise your hand. Thank you, sir.